I am Lisa Shire, Vice President of Food and Nutrition and Environmental Services for Aurora Health Care. Aurora is a 15-hospital system in southeastern Wisconsin. We have over 32,000 employees, and we are very proud to be the largest employer in Wisconsin. Aurora decided in 2012 to go through a supply chain initiative, and that's when Food and Nutrition was approached to how are we going to save dollars across our organization. So I led the efforts in Food and Nutrition to help standardize and centralize food and nutrition. That entailed us to build a corporate structure to help support our sites so that they could concentrate on their daily operations.
I'm Mary Ahlers, the Corporate Manager for Patient Services with Aurora Health Care. I'm responsible for patient services and ensuring that the processes that we use in our patient room service, call center, our tray line assembly, and our meal delivery meet the high standards that we expect. We have 13 hospitals that use our room service program. Standardizing across the system helps keep our quality standards high. It's for having that consistent quality throughout all of the hospitals. We have a call center, and our goal is to have 95% of our patients calling to the call center to place their meal orders. The biggest results that we've achieved through this is that the call centers are much more accurate, so we are able to ensure that the patients receive the correct therapeutic diet as well as following the patient allergies. Getting the hospitals to work together was slow at first, but gradually as we worked as a team and determined what the standards would be, everybody got excited about it and was able to come together. We only have 2 people that have access to working with our database. This allows us to have accurate nutritional information, and it keeps integrity of our database, which is very important to us. We had a group of representatives from all of the hospitals come together to determine the standards that we will use for our tray makeup. This allowed us to enhance what we're using for our trays.
My name is Bruce Parker, and I'm the Corporate Retail Manager for Aurora Health Care. My role in the organization is to bring standardization in the areas of technology, retail pricing, and marketing to help us grow our revenues. Back in 2015, we decided to install and also migrate our current Micros 3700 to the new Symphony POS system. We now have 28 locations with 39 registers that all roll up under one enterprise system. The system allows me as the retail manager for the organization to control the items and the pricing, and as we introduce new items or do promotions, I can actually export that out to the other sites. We also have the Odyssey PCS system that allows our 32,000 caregivers to use their ID badge for a program we call Dine and Debit, which allows them to charge in our cafeterias. What's great about the Dine and Debit program that when it's introduced at sites, we see anywhere from 8% up to 20% retail growth. Well, I think the reason that it's been so successful is that our caregivers find the card to be very convenient. You can see in a hospital setting that doctors and nurses come from areas where they might not necessarily have money with them, so it makes it very convenient for them. The bartender technology was a great fit for Aurora. We recently installed Food Service Suite across our organization. So it really allowed both systems to work in tandem with each other, and this has allowed us to comply to new federal mandates for labeling. So now we've got nutritional information, ingredient list, consistent pricing, and a consistent look in all of our grab-and-go locations.
We are so proud of the results that we've been able to accomplish in the last few years. We have over 14% increase in cash revenue. We've seen a 53% increase in supply rebates, and we've seen $1 million year-over-year savings in food cost. And these are just a few of the results that we've been able to see. One of my original goals was to have one technology platform across the system for a variety of reasons. Number one, it helps us to standardize not only our patient menu and the integrity of the nutritionals across the organization, but it also helps us drive our cash retail revenue. And that's for having the POS and the dine-in debit and the cashless system that we have. And it can all be housed under one enterprise system.